The purpose of this video is to explain the changes that have been made to the Adult Sedation Agitation Scale, the Daily Spontaneous Awakening Trial, and the Daily Spontaneous Breathing Trial Assessment Policy. It will also describe how the EPIC documentation process for intubated and sedated patients has been modified to correlate with the policy changes. First, when taking care of patients who are sedated and intubated, the level of sedation should be monitored. The sedation scale that is used for the St. Francis Health System is the Riker Sedation Agitation Scale, also known as a SAS. SAS is used for the initial and ongoing monitoring of a patient's response to sedation. This scale is used to guide sedation therapy. Most patients should have a SAS score of 3 to 4. This indicates that the patient is able to arouse easily and follow commands. If the patient is not at a SAS score of 3 to 4, the patient may be over or under sedated. The SAS score is documented in EPIC on the complex assessment flow sheet in a section labeled Mechanical Ventilation. When documenting a SAS score, pick the level most appropriate to your patient. The row information will provide a description of each level from the Riker Sedation and Agitation Scale. When documenting the respiratory assessment of a patient with a ventilator, choose the option X equals exception to WDL. This will cause additional row information to cascade open for further documentation. Highlight the row ventilator patient and select Yes. A pop-up window will appear for the nurse to confirm what information is included in the next set of cascading rows. The cascading rows will include the Vent Settings section, the Daily Spontaneous Awakening Trial SAT section, the Daily Spontaneous Breathing Trial SBT section, and the IHI Ventilator Associated Pneumonia Bundle section. In the Vent Settings Match Order row, the only option to select is Yes. The ventilator should always match what is ordered in the patient's chart. If the ventilator settings are different from what is ordered in the patient's chart, resolve the discrepancy and ensure the order and the ventilator match. The Sedation Vacation section will now be referred to as the Daily Spontaneous Awakening Trial section. This change has been made to align with the updated policy and verbiage more concise with evidence-based literature. The Daily Spontaneous Awakening Trial Performed row will provide options to select if the SAT was performed or not performed. If the patient has contraindications preventing them from participating in an SAT, document the contraindications in the appropriate row. When selecting the contraindications row, a list of all of the current contraindications will be available to choose from. Check the row information to determine what qualifies as hemodynamic or neurologic instability. If the patient does not have a qualifiable contraindication, then an SAT should be attempted. In the Start-Stop row, select to document when the Spontaneous Awakening Trial began. Next, select the Interventions row to document how you performed the SAT. Remember to communicate the plan with respiratory therapy. Follow the policy and the order when selecting to decrease or lighten sedation. While the patient is performing a spontaneous awakening trial, continue to monitor for signs of intolerance. If the patient has intolerance, insert a column and document which intolerance parameters were met in the reasons for intolerance row. If the patient fails a spontaneous awakening trial, document what time the SAT was stopped in the SAT Start-Stop row. Don't forget to document interventions in the Interventions row. If an SAT is performed and the patient has a SAS score of 4 without signs of intolerance, assess the patient for a daily spontaneous breathing trial. Document that the daily awakening trial was performed in this section. Next, document if a spontaneous breathing trial was performed in the row labeled SBT performed. If the patient has contraindications, document which contraindications apply. The IHI Ventilator-Associated Pneumonia Bundle section consolidates information into one area to help ensure interventions are performed to prevent a ventilator-associated pneumonia. This section should be documented on every patient with a ventilator at least once per shift and PRN. The group information box has additional information for reference if needed. The oral care, anti-embolism, and repositioned rows are linked to the daily cares flow sheet, allowing the documentation in the daily cares flow sheet to be pulled into these rows. For further information, please refer to the St. Francis Health System policy.